It's day 3 after having your baby, and you both just woke up and your breasts are feeling like 2 hot, hard, swollen rocks. And you're like, I need to latch my baby. And you try it, but there's nothing to latch onto. And your baby's crying and you're in pain and you're wondering, is this what breastfeeding is going to be like the entire time? If this is where you are right now, whether you're breastfeeding or formula feeding, this video is going to teach you all you need to know. So why is this happening? And what do you actually do about it to get some comfort? My name is Erin Moore and I'm a pediatric nurse practitioner and a lactation counselor here to serve up some bite-sized pieces of feeding information so you can feel good about feeding your baby. Make sure to hit subscribe. Breast engorgement is something that I talk to families about all the time in clinic. And I want to tell you something right away. Breast engorgement does not mean that there is something wrong with your body. It's actually very typical for both breastfeeding and formula feeding moms. Once you understand why it is happening and what to do about it, it becomes a lot more manageable. So let's start there. Let's start with the why. In the first few days after delivery, your body is producing colostrum. That is the liquid gold, that thick, yellow milk for your baby. But somewhere between day 2 and 5, your body starts to make transitional milk. So it's transitioning from colostrum milk to more mature milk. And when it happens super fast. Your breasts aren't just being filled with milk. There's increased blood flow, there's increased inflammation, lymphatic fluid, and there's water being pulled in to make milk. There's a lot going on that's not just milk production. It doesn't just happen to breastfeeding moms. It happens to any mom because it's triggered by a hormonal shift when you deliver your placenta. So even if you're not removing any milk, you're still going to have some milk coming in. It surprises a lot of moms. And even though it's normal, it's really hard to prepare for what it actually feels like when it's happening to you. Like, even if you know it's going to be a little bit rough, when it actually happens, wow, you know. I want to talk about the 2 different types of engorgement. The first one is early postpartum engorgement. That's what we talked about when your milk comes in or starts to transition from colostrum to more mature milk. That's the really hard, fast feeling of tenderness. Sometimes it extends all the way up until your armpit. Sometimes it feels like you have 2 rocks on your chest. And it is very, very shocking. Early postpartum engorgement usually peaks between days 3 and 5 and goes away once the inflammation and everything sort of settles down in the breast. The second type is situational or ongoing engorgement. And this happens when your baby starts sleeping through the night. If you miss a feed, sometimes it's due to oversupply. Both of these types of engorgement are handled pretty similarly, but I'll point out some differences along the way. Before I get into exactly what to do, if you found this helpful, make sure to hit subscribe for bite-sized pieces of feeding information. Okay, now what you're here for. What do you do when you're feeling engorged? I want to walk you through what to do before a feed, during a feed, and after a feed. This is exactly what I teach in clinic. Before you feed, you can try reverse pressure softening. It's something that a lot of people don't talk about, but can be really helpful if you're trying to get your baby to latch, but your nipple is so taut that their baby can't latch. So what you're going to do is you're going to put your fingers right at the base of the nipple onto the areola, and then you're going to put pressure toward the back of your chest wall. You hold it for about a minute, and really it's beneficial if you're laying back because that's helping gravity work for you and not against you. You do this all around the base of the nipple in different areas, and then it might make it a little bit easier for your baby to latch because all that lymphatic fluid that is going down toward the nipple is moved backwards. So it's not very glamorous when you're doing it. It feels a little bit funky, but it can be really helpful in getting your baby to latch and actually removing milk. Another thing to try before you feed your baby is doing a little bit of hand expression. So if that reverse pressure softening isn't working, try hand expressing a little bit of milk. And you do this by putting your fingers at the base of your areola, moving your fingers toward your chest wall, and then squeezing forward a little bit. We're still not expecting you to get a ton of milk, but you might see that the milk has become less liquid gold and less thick to a little bit more liquidy or white. The third thing you can do for engorgement before you feed is lymphatic massage. There are a lot of really good and detailed videos on actually what to do, but the premise is that you're moving lymph fluid from in the breast up toward the armpit so it can more adequately drain and make you a little bit more comfortable. So it's very, very soft and tender touch upward, away from the nipple and up into the armpit. The fourth thing you can do before you feed is breast gymnastics. So I really like this more for when you're feeling engorged and it's not those early days where you have a lot of inflammation. But what it does is it helps elongate the ducts in different parts of your breast. So it is literally taking your breast and going up and down, into the side, into the other side, circling it one way, circling it the other way, and then doing very, very gentle massage around your breast. And you can repeat that. You can do it before you pump. You can do it before you feed your baby, as long as you don't have oversupply and really fast flow. But it can really help alleviate some of that discomfort within your breast. During a feed, your position matters more than you think it does. So sometimes it's really hard to get a baby to latch when you're engorged. Sometimes doing laid back feeding and then having your baby latch onto you that way can help gravity work for you. If you're feeling really uncomfortable or full, do the things that we talked about before a feed, but really make sure your baby is latched on very nicely. And if you're experiencing a lot of pain because they can't latch, make sure to take them off and try again. Between feeds, if it's okay with your OB, usually ibuprofen can help with the inflammation or the swelling in your breast and can make feeding a little bit more comfortable. Sometimes there are reasons that you shouldn't use ibuprofen, so make sure to talk to your OBGYN. The other thing that you can do is use ice or cold. We don't want you to use heat because that can actually dilate and make the swelling worse. Whereas if you're using cold, it can make everything tighten up a little bit and can make things more comfortable for you. What do you do about engorgement if you are not planning on breastfeeding? So like I said, you will still have some level of inflammation and you will have some milk coming in, even if you're not removing milk because of the delivery of the placenta. So that means you're having discomfort and you need to do something about it. The other things that we had talked about at the beginning, those do apply to you too. I really like the breast gymnastics, so moving the milk within the breast without actually removing milk to trigger the body to make more milk. There are other things that you can do like cabbage leaves or Cabo cream, which is available on Amazon. There are other medications or teas that you can try to decrease your milk supply faster. The engorgement will be temporary and should go away fairly quickly if you're not removing milk at all. One important thing to talk about is engorgement versus mastitis. So some of the symptoms might mimic one or the other, but I'm going to tell you ways to know which one is which. So first, if you're feeling engorged, usually it's in both breasts. It's usually all around, not just localized to one area, or maybe it is localized to one area. It might feel a little bit tender, maybe a little bit warm. But when you have mastitis, it's often localized to one area. It's tender, it's warm to touch, often kind of painful. And you're going from feeling it just in the breast to feeling it sort of all around the body. Now, sometimes right away postpartum, it's hard to tell because you're feeling already kind of run down. You literally just like ran this crazy marathon of having a baby, and now you're up every 2 hours to 2.5 hours feeding that baby. So you're going to be exhausted. But if you're starting to have like body aches, chills, kind of flu-like symptoms, or you have a fever that's anything over 100.4, or even if it's creeping up there, definitely talk to your OB because it could have gone from being engorged or having milk sit in one place to actually being an infection that could really affect you. Can you prevent engorgement? So after the initial engorgement phase, here's what I tell families to do. We want to make sure you're feeding your baby on demand. So every 2 to 3 hours, or on demand if they're hungry earlier. And then you don't necessarily need to remove all the milk from your breast, but you do want to make sure that baby has an effective latch and they're actually sucking and swallowing and removing the milk. I like to remind families to not skip feeds. So if your baby is sleeping a little bit longer, that is great. But if you're waking up because your breasts are feeling full or uncomfortable or you're leaking, you can hand express and keep it on your bedside table, or you can do a fuller pumping session if you need to. When do you need to ask for help? Now, if you have any signs or symptoms of mastitis, or if you're questioning if you have mastitis or not, definitely reach out to your OB. You don't want to mess around with that, and you want to take care of it right away. If your baby is not gaining weight, their latch is really ineffective, they get on the breast and they fall asleep right away, they're jaundiced, they're not having enough wet or poopy diapers, you definitely want to contact your pediatric provider and a lactation professional too. Now, if you have any other questions, or if you feel like your engorgement is not normal, that, it should be going away, but it's not, or if you feel like it's just really uncomfortable all the time and it's always there, definitely reach out to a professional. Engorgement is one of the most common reasons why women quit breastfeeding. And I get it. It's very, very painful. But doing these things can make it a little bit easier. I want you to know that it is temporary. Your body is doing what it's supposed to be doing, and you're doing great. So make sure to ask for help, whether it's booking a consult with me or going and seeing a lactation professional or your baby's pediatric provider. Make sure to hit subscribe for bite-sized pieces of feeding information. And if you are wondering a little bit more about how to get your baby to latch, make sure to watch the linked video.